smoking. It's often portrayed as alluring, rebellious, even sophisticated. But behind the smoke and mirrors lies a harsh reality, a cocktail of over 7,000 chemicals, many of which are toxic and detrimental to your health. This isn't about being preachy, it's about understanding the science behind how smoking affects your body. We often hear about the dangers, but let's delve into the why. One of the most insidious culprits is tar. Imagine this. Each puff coats your lungs with a sticky residue, like gradually tarring a road. This tar paralyzes and destroys cilia, tiny hair-like structures that help clean your airways. The result? Increased susceptibility to infections, chronic bronchitis and emphysema, a condition that literally makes breathing a struggle. Then there's carbon monoxide, a colorless, odorless gas that's anything but harmless. This sneaky saboteur displaces oxygen in your bloodstream, binding to your red blood cells with a greater affinity than oxygen itself. The consequence, your body, starved of oxygen, struggles to function optimally. This can lead to shortness of breath, fatigue, and even heart problems. But it's not just about the immediate effects. Smoking has long-term consequences that are far more sinister. Nicotine, the addictive component in cigarettes, stimulates the release of dopamine, a neurotransmitter associated with pleasure. This creates a cycle of craving and reward, making quitting incredibly challenging. The damage inflicted by smoking extends far beyond the lungs. It's like a domino effect, triggering a cascade of health problems throughout your body. One of the most alarming consequences is cardiovascular disease. Smoking damages your blood vessels, making them narrower and more prone to blockages. This increases your risk of heart attacks, strokes, and peripheral artery disease, which can even lead to amputation. But perhaps the most chilling statistic is the link between smoking and cancer. Cigarette smoke contains a plethora of carcinogens, substances capable of causing cancer. These carcinogens wreak havoc on your DNA, causing mutations that can lead to uncontrolled cell growth. Lung cancer is the most well-known smoking-related cancer, but it's just the tip of the iceberg. Smoking increases your risk for a staggering array of cancers, including bladder, esophageal, pancreatic, and even cervical cancer. It's not just about you either. Secondhand smoke, the smoke inhaled involuntarily by non-smokers, contains many of the same harmful chemicals. Children exposed to secondhand smoke are at increased risk for ear infections, asthma attacks, and respiratory illnesses. Pregnant women who smoke expose their unborn babies to a host of dangers, including premature birth, low birth weight, and even sudden infant death syndrome, or SIDS. The good news is that it's never too late to reverse the damage. Quitting smoking is arguably the single most important decision you can make for your health. The benefits begin to accrue almost immediately. Within just 20 minutes of your last cigarette, your blood pressure and heart rate begin to return to normal. Within 12 hours, the carbon monoxide levels in your blood drop, allowing your body to transport oxygen more efficiently. Within 24 hours, your risk of heart attack starts to decrease. As the days turn into weeks, your lung function improves, and you'll notice you can breathe easier and cough less. Within a year, your risk of heart disease is cut in half, and the benefits continue to accumulate. After 5 years, your risk of stroke is significantly reduced. After 10 years, your risk of lung cancer is half that of a smoker's. And after 15 years, your risk of heart disease is similar to that of someone who has never smoked. Quitting smoking can be incredibly challenging, but it's not an insurmountable feat. Millions of people have successfully quit, and so can you. There are countless resources available to help you on your journey. Nicotine replacement therapy, or NRT, can help manage withdrawal symptoms by providing you with a controlled dose of nicotine without the harmful chemicals found in cigarettes. NRT comes in various forms, including patches, gum, lozenges, and inhalers. Counseling and support groups can provide invaluable guidance and encouragement. Talking to a therapist or joining a support group can help you develop coping mechanisms, manage stress, and stay motivated. Your doctor can also prescribe medications that can help reduce cravings and withdrawal symptoms. Remember, quitting smoking is a marathon, not a sprint. There will be setbacks along the way, but the important thing is to never give up on giving up.